And welcome to our virtual Facebook Live Town Hall meeting. Just a few admin notes before we get started. As a reminder, please refrain from discussing personal health information during this open forum. Also, you can start sending your questions via Facebook now, and we'll answer all of your questions during the Q&A session. Our Chief Veterans Experience Officer, Lindsay Bernard, will now explain how we're going to participate, how you can now participate via telephone. Lindsay?
Good evening, everyone, and thank you for joining our Facebook Live event. My name is Lindsay Pinard, and I'm the chief of our Veterans Experience Office here in Atlanta. Some people also know us as the Patient Advocates Office. We wanted to try something a little different during this Facebook Live. We have a dedicated number for you to call and submit any questions that you may have. That number is on your screen and is also 404 321 6111, extension 202264. I bet some of you are thinking that sounds familiar, right? Well, it should. It's the same number that you dial to speak to an advocate during regular business hours. We've brought in devoted staff to answer that line and take your questions. You'll be able to hang up from your question submission and attend the Facebook Live event online or through the phone line that we have dedicated for that at 404 397 1596. And after that answers, you will dial the code 199 889 6724 and hit the pound. You'll be able to hear all of the content of this event on that line. We will get all questions answered as long as time is permitting. This is our first time trying this, so we hope to be able to duplicate it in future town hall meetings and perfect it as we move forward. We did this to ensure that we keep everyone's information safe and secure during the broadcast. The staff will ask you for your information, but it will not be released. We only ask in case that we need to provide you additional follow-up once the event is over. If the question that you have is specific to your personal situation, we will get in touch with you in the days following the event to ensure that your needs are addressed promptly. We have other ways for you to get in touch with the staff here in Atlanta from the comfort of your home computer, such as My Healthy Vet or secure messaging. You can email your clinical care team or advocate staff to have your topic addressed at any time. We always want to hear from you, so please make sure to take the surveys that we send you. We utilize that information as well for process improvement. We appreciate you contacting us, no matter if it's a concern, recommendation, or compliment. This is going to be a great event. So without further ado, I'll hand it back to Ms. Brown, and she'll kick us off.
Well, good evening, everyone, and thank you for joining our Facebook Live virtual town hall. As you've heard, we're going to try things a little differently to make sure that we don't have personal information come out over Facebook. So please take advantage of the phone conversations and the putting in questions in Facebook Live if it doesn't include personal information. So, again, thanks for being here. I just wanted to run through a couple of things we're going to talk about, but this is mostly a conversation that we wanted to have and to make sure we answer questions or any concerns that we didn't hit in our agenda. So let me just run through a couple of things that we're going to talk about. First, we're going to have a community care update. There's been some changes in community care that we wanted to let you know about. And then, of course, we're going to talk about COVID-19 update, what we've done with COVID since it all began in March, and then move to our moving forward plan, which we set up last week to stop talking about the event and start talking about how we're going to provide health care to our nation's heroes with COVID-19 and not just about COVID-19. We've opened up some new CBOCs even during COVID-19, and we want to talk a little bit about that and what's coming in the future. Customer experience, I'm sure I chuckled a little bit when Lindsay was talking about call us, and I'm going, yeah, that's the biggest problem we have with our customer service. So we're going to talk a little bit about what we're doing with to fix the phones. And then a little more about this upcoming flu season, which is going to be different when we're dealing with not only the flu season, but with COVID and what we're doing to prepare for that. And then the most important part, you have the ELT here, the executive leadership team here in the room to answer questions and take down concerns and have some dialogue back and forth. So that's what we're here for. Thanks for joining. We are interested in comments when this is over about how it went and ideas on how to do things a little bit differently, because we're making this up as we go on how to do town hall meetings with social distancing. So the first thing, Dr. Correa, our Chief of Staff, is going to talk about some things going on in community care.
Hello, everyone, and my name is Dr. Correa, and I'm your Chief of Staff. And I wanted to give you an update of the changes that we have had in community care, our non-VA care that is provided in the community. As you know, the care that we provide in the community is funneled and it goes through a section of our VA that is called that non-VA care. We used to have an intermediary provider that was called TriWest that provided the network of physicians and facilities in the community that would get consults from us to get you the care that you needed when we were either not able to provide it here or we needed to provide it closer to your home. That network called TriWest was effective until September 4th, when we had a transition and change to a probably more familiar name that you would recognize, that is called Optum. Optum is a subsidiary of United Healthcare. So as part of that United Healthcare Optum provider, we have a new network. And that has been a big change in the last few months as we have been transitioning to the new provider. That Optum Care he is currently, even as we speak, continuing to add more physicians and groups of physicians added to their network of providers available for us and you to use. Emory and Wellstar, which are the biggest providers of care in the community that we have in our Atlanta coverage area, have been already added to our network, and so that they're already part of the network. And then we have Piedmont, which is the third largest, which is currently being negotiated with Optum. So this is all not necessarily transactions that are being done by the VA, but more Optum adding individuals and groups that are going to be added to their network of providers that we can utilize. So as that moves on, we should be able to have everyone on board and have everyone needed to continue to provide the care. But we are very excited that now for the last couple of months, we have been able to have the biggest providers in the community, which are Emory and Wellstar, added to our services. Of course, in the last few months, and I'm saying few months, but since February, we have had the difficulties of having COVID-19 being a factor on how the care is provided. And that is not just exclusive for Atlanta. It's a nationwide phenomena that has limited our ability to really be able to connect and have face-to-face appointments in the community. And that has slowed down a little our ability to get you connected. Just like everyone else in the community is facing, we are also facing when it comes to being able to have that availability of face-to-face appointments in the community. So with that, I think that that's all I have when it comes to the NVCC or non-VA care, community care update. Thank you.
So next, we're going to turn it over to Dr. Stevens to give us an update about what's been going on at the medical center and our CBOCs since we last met with COVID, and then move on to the moving forward plan. So Dr. Stevens.
Thank you, and thanks to everyone for joining us this evening. It's been 6 months since we had the first case of COVID in the state of Georgia. So we've had a lot going on here in the state as well as here at the Atlanta VA. We've done close to 9,000 COVID tests here at our facility for veterans and staff. Similar to some of the rates in the community, we've had about 10% of those tests come back positive. And we're happy to say that almost 90% of the veterans have already recovered from their infections. We've admitted almost 250 patients to the medical center with COVID infections. So we've been quite busy and active like the rest of the state. We are happy to report that the state of Georgia has seen decreasing numbers of COVID positive patients and COVID admissions throughout the state. And we similarly here at the Atlanta VA have started to see over the last few weeks a decrease in the number of COVID cases diagnosed daily and the number of patients who require admission to the medical center for COVID. We currently average about 40 active cases at a time. Those are both inpatients and outpatients. And our inpatient census has gone down from the beginning. And our current census tends to run under 20 patients in the hospital at any given time. The good news for that is that we've been able to reallocate some of our resources, staff, and space for our non-COVID operations here at the medical center. We've been able to convert some of those beds that we had reserved for possible COVID surges back over to non-COVID beds in order to be able to accommodate more veterans. The state as a whole has seen rising numbers of hospitalized patients for non-COVID related illness. And similarly, at this time of year, as we start to get into flu season, we're preparing to be able to accommodate all of the veterans who need hospitalization here at the medical center. The things that we are continuing to do for everyone's safety is we're continuing to screen all veterans and visitors and staff who enter the medical center. That means we will still be limiting access to single points of entry in order to ensure that we can screen everyone who comes in for the safety of both the veterans and the staff. We are continuing to require face masks in the facility. Everyone who enters the facility is required to wear a mask. If you don't have one will be provided for you at the screening entrance. We are continuing to encourage veterans to use our virtual care options whenever possible. This limits exposure and limits your risk having to come to the medical center. We are continuing to offer testing for symptomatic patients and symptomatic employees, both in person in our urgent care and emergency department, as well as at our drive-through testing, both at the main medical center and at the Oakwood community-based outpatient clinic. We are maintaining separate spaces in our emergency department, ICU, and on our inpatient wards for patients who have confirmed or suspected COVID diagnoses. We are continuing to limit visitors into the medical center. We've also worked to centralize our check-in process at the front of the hospital to reduce the number of people in waiting rooms at any given time so that we can maintain social distancing whenever possible. And most importantly, and I think we'll talk about this later, we're encouraging everyone to get their flu shots this year. That's one important thing that you can all do to help prevent flu-like illness this season. Now that we've seen this decrease in COVID cases, we are focusing our resources on moving forward and redefining how we deliver healthcare in the environment of COVID and what our new normal will look like here at the Atlanta VA. And that really transitions us over to the next topic, which I'm also the speaker for, which is moving forward. So I'll just move right in.
Do we need to
that.
pause?
Yes. I don't know if you want to
Okay.
pause, put my name back up, but
Right, so now Dr. Stevens is going to talk about moving forward.
So, the safety of our veterans and staff is our highest priority when we consider how we deliver healthcare during the coronavirus pandemic. We continuously reassess the rate of COVID infections, not only in the state of Georgia and in our local community, but also among the veterans we serve. And this helps us to determine how we can progress with reintroducing services. For those of you who've seen the national plans, we're currently in phase 2 of charting the course, which is where we're maintaining continuous services to veterans and starting to resume some of our normal pre-COVID operations. So in this phase, we're expanding non-emergent procedures and services. We've taken an approach of trying to prioritize the services that can't be delivered through our virtual care modalities. As a whole, in the medical center, we've seen that we're still delivering care in both primary care and mental health to the same number of patients, actually even more than we were seeing this time last year. But as most of you are aware, the majority of that care has shifted to our virtual modalities. But for patients who have urgent and emergent needs that can only be taken care of in person, we do offer face-to-face visits for those patients. We have also been very proud of the work that our telehealth group has done. We've been leading the nation in our VVC or virtual video connect visits. Last year, we only saw about 1,000 virtual care visits a month. And the last 2 months, we've seen over 20,000 veterans through our virtual care modalities. So that's a huge change in the way that we deliver healthcare. And now we're focusing on reopening and moving forward safely with services that can't be provided face-to-face. We're happy to say that as of this week, our operating room is back up to 75% of its pre-COVID capacity. And we are now offering lab services at most of our community-based outpatient clinics daily from 8 to noon. We have rethought how we deliver care. We're now doing curbside audiology services. We're doing drive-through testing services and a lot of new innovative ways to have you come in and get the care that you need while keeping you and our staff safe. Coming soon, we'll be expanding some of our procedural services, like the GI endoscopy suite, our cardiology services, some of our other services like dental and ophthalmology that require face-to-face visits. And we're also working on safely expanding our capacity to do face-to-face care for primary care and primary mental health care services. I think that's all I have, but we have been created a new interdisciplinary team here at the VA, which is led by representatives from our strategic planning group, our clinical side, our nursing operations, as well as our safety and infection control specialists to help us develop a plan to reopen face-to-face care in the areas where it's the most needed.
So just a check to make sure that we're all on the same page. If someone had a question about moving forward and you know where we're providing what services as we rebuild the organization with COVID, are they putting where you call that number and submit a question, and in the end we will be going through the questions that we're receiving on the phone line. And so make sure if you had a question for Dr. Stevens, because I'm sure there are some out there that do, please submit, or you can do it on the Facebook Live page. I just got that note. So 2 ways you can submit a question, one through the phone and one on our Facebook Live. And when we get through these very quick presentations, we'll go and answer all the questions that you may have. So we are halfway there. And Fred Stevenson, our strategic planning guru guy, and clinic activation guy is going to talk us through what we've been doing in the past few months and where we're headed. So Fred, take it over.
Thank you, Ms. Brown. Welcome. Thanks, everyone online who we can't see for joining us. These are really exciting times, even though we're in a COVID situation or a COVID operation capacity. We're still expanding our access to care for our veterans. And I want to take a brief moment to go over some of the expansion we've done or we've gone through since January of this year when I last spoke to the group. Back in January 18th, we opened our South Cobb County Mental Health Clinic over on Herodian Way over by Truist Field. And that expanded our mental health, our both outpatient and our group mental health services to veterans in Cobb County. After that, we moved forward with our Covington primary care CBOC, which includes mental health services, lab services, and some other services. That's been a great addition to our footprint in the Atlanta metro area. Those veterans who live down in Covington and Conyers in an area don't have to travel over to Stockbridge and come here to Atlanta for care now. So they have their own CBOC, and that's been, again, it's been a great expansion for us. And we ran into COVID, but we didn't stop activating clinics as we were charged to do, and it's our duty to expand that care. So we moved into our Decatur Research and Development footprint, which is down Claremont Avenue, which is about 3 miles from here, where our incontinence clinic is going to be located. After that, we expanded, we closed the old East Point 700 mental health CBOC, and we moved into a brand new, newly renovated footprint at South Fulton, which is over on Phoenix Boulevard over in College Park, Georgia. So that footprint, again, is a brand new mental health only footprint, but it provides better access, larger expansion of our mental health services as we moved those services out of East Point 700 building and some capacity from Fort Mac over to South Fulton. Our last activation that we completed was on August 31st, with our Jasper Pickens Primary Care Clinic. That's been a long-awaited clinic for the 12% of veterans who live in the Jasper Pickens area. Prior to this clinic opening, veterans had to travel either to Oakwood or Rome or Blairsville for care. Now those veterans can receive care right there in their community. So that's really a game changer for those veterans who are traveling those long distances through mountains to get access to care. Our next activation we're slated for October 23rd. That's our West Cobb Clinic. It's a brand new clinic. It's actually a replacement clinic for our current Austell location. It's a much larger clinic. It's going to provide the needed relief we have because we really outgrown the Austell clinic. And we're expanding our services out there. Right now, one of the services that we're planning to have in that clinic, once the recruitment and onboarding is done, is podiatry services. So that's going to provide additional access to care to veterans in West Cobb County as well. Further along down the line, we're activating our CNP, our compensation and pension clinic, and our eye clinic in mid-December over here in the North Lake area of Decatur. And that's, again, it's going to expand our eye clinic. We're going to have 8 eye lane stations. Right now we have 5 here on our current footprint. So we're moving our eye operation off the main campus to a much newer and a much more expanded location. A little bit farther down the line, we're developing 2 large multi-specialty clinics. Those clinics are slated they're already 100% design and build. The Pike County Clinic, which is going to be located, multi-specialty clinic, which is going to be located in Zebulon, Georgia, which is in our southernmost part of our footprint. That's slated for construction completion early October of 2021 with staffing, build out, and other types of inclusions or construction, internal additions to the clinic. We're looking to have that clinic operational March, April timeframe of 2022. And that's a multi-specialty clinic that will include primary care, mental health, audiology, radiology, dental service, phlebotomy, home-based primary care, and other types of specialty services that we're still determining at this time. Our next operation is a major operation that covers 64,000 square feet in Cobb County, Georgia, that's going to be on Cobb Parkway in Marietta. And that's also primary care, mental health, primary pharmacy services, audiology, prosthetics, and some other types of specialty services. So a lot's going on. The Cobb County Clinic is slated to it's already broken ground. We've just received the land disturbance permits, and building permits are within the next few days, and we're slated to start the construction process in early October to mid-October of this year. That's about an 18-month build-out, so that clinic should be operational around summer 2022. So a lot of things happening in our footprint. We're growing, we're providing better access, greater access to care, and that's just what we need. So thank you for your time, and that concludes my presentation.
Okay, thank you. So any questions for Fred, please put them on Facebook. I see that we've got a few coming in now, and it looks like we have some questions coming in on the phone, so that's good news. All right, so the next presentation is about this is Danielle Terrell. Danielle, I don't think you were here last time.
I wasn't.
No, she is here acting as our assistant director. We borrowed her from Columbia. So be nice to her. She's a little nervous. It's her first town hall. So Danielle's going to talk to us about our phone situation and what we're doing to fix the phones.
So I have the exciting topic of Fix the Phones. So in June, we told you that our phone upgrade process would begin in the month of August. And we are excited to say that we've begun the preparatory work for that. We estimate completion sometime in early 2021. Until we have more information on the national contract, we are unable to commit to a specific timeline, but dates of significance will be released as we get more information. But part of our prep work was beginning this week. We did a 100% inventory of all of our telecom equipment so that we could be ready for our upgrades. And we've also worked to resolve some of the technology concerns that you've experienced calling our medical center. In the month of July and August, we had a lot of veterans that called in, and your call went directly to a busy signal. So we expanded our call capabilities with our existing software to prevent that occurrence, and added more monitoring to our auto call distributor software to make sure that our calls don't build up and create that problem again in the future. The other thing we've done is we installed new phone systems in some of our community clinics. So Pickens, Decatur Research, South Fulton, Covington, South Cobb, and Northeast Cobb all have the newest telephone equipment that's helping to deter those technology concerns from occurring in those locations. So we ask for your patience. The complexity of calls related to COVID have lengthened the amount of time that we're spending on the telephone with each of our veterans. We're doing education on telehealth technologies and converting face-to-face appointments to telephone and VVC. We're doing a lot of pharmacy services over the phone, and we're also providing the much-needed coordination of care. All of those activities take a much longer time on the telephone, and at times that can back up our phone system. So we ask for your patience as we work to add resources and redesign our phone system to better serve you. Our Veterans Contact Center is in the process of a redesign. And one of the ways that we're redesigning our system is to create separate lines for primary care and mental health and specialty care so that you don't have to have your calls forwarded and we don't have to worry about calls dropping. And as we work to improve these services, we will keep you involved and keep you in the loop as this system transitions. And we appreciate your patience as we strive to meet all of your expectations and work through any concerns that you let us know about through our patient advocate line.
Okay. Well, thank you, Danielle. You did a great job, although you're as red as your lanyard. So, but you made it through, so congratulations. Next, we're going to go, and this is our last presentation. Dr. Correa is going to speak with us again about the flu shots that I think are arriving now, and how we are going to, with COVID, get out flu shots and keep everyone safe.
Thank you, Anne. And so this year, more than any other year in the recent past, it is very, very important that we commit all the efforts to get our flu vaccine, and that is you as veterans, and that is us as employees. Our goal for our employees is to have 100% of employees vaccinated with the flu vaccine this year. And that is something that we are totally committed to get to that goal and reach that goal. And we need your help in getting also all of you vaccinated and telling everyone, not only your family and your friends and everyone that you know, that it is very important to get the flu vaccine. Why? Because we want to reduce the chances for you to have two terrible and very devastating respiratory infections at the same time. Or even if you have it within the same year, it can be quite devastating for you as an individual, and it can put at risk a lot of individuals that would be in contact with you. So we are providing and will be providing the quadrivalent vaccine, regular dose and double dose or higher dose for those individuals that require that double dose. And we want to make sure that all of you have access to it. We started receiving the vaccines at the end of last week, and we are distributing those vaccines to the CBOCs. There are some CBOCs that have already received them, and they are starting to have those delivered and given to veterans that come in to get their regular appointments, those face-to-face appointments, or when you go and get laboratories in the CBOCs, you can get your vaccine that way. But in addition to that, we will be having clinics offering the vaccine Monday through Friday from 8:30 to 12, and then 1 to 3 every day for individuals that have that don't have necessarily an appointment established to go and see your primary care physician, or to go and get laboratories, or to go and get another injection that you may have been scheduled already. Those individuals will be able to get the vaccine at that time too. But even if you don't have an appointment, you would be able to go and get that vaccine, that flu vaccine, from Monday through Friday, 8:30 to 12, and 1 to 3 p.m. in all the CBOCs. We want to make sure that the CBOCs also have the ability to have drive-throughs and also have parking access for you to get the vaccine in your car and park in your CBOC parking and have that access to the vaccine like you have been getting already some of the services, including some vaccines. I know that you have been getting at the CBOCs that way, where you come in, you park, you have a phone number that you call, and the nursing staff and the staff from the CBOC goes to your car and delivers that. At the Atlanta main campus, we will have the flu vaccine provided also Monday through Friday at the CLC Loop, and that is the old shuttle service pickup and drop-off location. And there, and the veterans will be able to drive through 8:30 to 3 p.m. So again, the CLC Loop, and that is the old shuttle service pickup and drop-off, where you would be able to drive and get your vaccine from 8:30 to 3, and that is starting 9/21. So next week, we will be starting to have that. And there will be more information provided and reminders about this provided via Facebook and also all over campus. And we'll have and more updates when it comes in terms of reminding about that. We have had a few complaints from veterans that attempted to get their vaccine from one of the participating pharmacies, and that is CVS, Walmart, Costco, Kroger's, and Walgreens. And there is a national issue when it comes to coding that is being fixed as we speak. And soon we'll have also information provided to you regarding the ability for you to be able to get those vaccines, the flu vaccine in those areas too. And that's all I have. I want to make sure that we all work together to get the vaccine for everyone, not just the employees, but every veteran out there. We want to make sure that you help us enroll and get all your veteran friends in and get the vaccine that will be available for everyone. Thank you.
Okay, we'll now start taking questions. We'll take a couple from Facebook and then we'll take some from the phone. First question from Facebook: when will the lab be available to veterans at all the CBOCs? That's the first question. When will the lab? Where can veterans go to get their labs done right now?
So thank you for the question. So currently at all of the CBOCs where we provide primary care services, we now have lab availability from 8 to noon, Monday through Friday. So reach out to your provider, make sure that their labs are ordered so we can get you scheduled to come in. But we have opened all of our community-based outpatient clinics where we provide primary care services for lab services Monday through Friday from 8 to 12.
Okay, next Facebook question.
But, so let me just ask a clarifying question. So if I'm coming in for a lab draw, do I need an appointment to get a flu shot? Or,
No, if you're already scheduled,
good
if you're already coming in for another reason, we will have flu shots available at the community-based outpatient clinics starting Monday, the 21st. So they may not be available this week, but if you're coming in anytime Monday, the 21st or later, for any other reason, we encourage you and your provider and the staff at the CBOCs will be encouraging you to get your flu shot while you're there.
Absolutely, and it will be offered. That will be one of the things that everyone that comes through that door will be offered the flu vaccine.
Okay, next Facebook question. When will cardio be taking face-to-face appointments again?
So cardiology is already seeing some patients for face-to-face visits, but they are still providing a good proportion of care through telehealth modalities. We are currently working to expand the number of face-to-face visits in the cardiology clinic, but for anyone who has an urgent or time-sensitive cardiology need, you can be seen and you will be seen face-to-face in the cardiology clinic. We anticipate expanding the face-to-face availability in that clinic in the next few weeks.
so that's a discussion between the veteran and their provider on when to have that scheduled?
Absolutely. So we are prioritizing patients who have needs that can't be seen virtually to come in for face-to-face visits. So reach out to your provider in the cardiology clinic or your primary care provider, and they can consult with cardiology about getting you scheduled for what you need.
And just to plug that the easy way to reach out to your provider in any clinic is using secure messaging through My Healthy Vet.
Okay, one more Facebook and then we'll go to the phone. This veteran wants to know, when will the main campus be open again? I have pictures that have been waiting for pickup since March.
So the main campus is open. We are open in our emergency room 24/7, and all of our, well, the majority of our clinics are open where our providers are providing virtual care and some face-to-face care for those who need it. Not sure I can answer your specific status about your dentures, but if you reach out through our patient advocate office, we can find out the status of your dentures. I don't know if you're referring to a dental appointment in our dental clinic, which is at the Atlanta VA clinic, not here at the main campus. They have been only seeing urgent and emergent cases in the dental clinic at AVC. But I'm not sure if you're referring to prosthetics and needing to pick something up. We certainly have ways that we can have things delivered to you, or make arrangements for you to get any medical equipment or needs that you have. So you may want to reach out through our patient advocate office with your specific need, and we can make sure that we get that service to you.
Yes. Our first question is, does ROI have a fax number, release of information, for people to submit their medical record consents and request forms?
Okay, so I'll take that one. Our release of information fax number is 404-417-1606.
You can post that on Facebook.
And we can
too.
post that on Facebook.
Our next question, I believe, has already been answered, but just to reiterate so everybody understands the information, when will the Atlanta VA allow face-to-face for routine visit appointments?
So one of the things I do want to talk about when we think about how we deliver care going forward in the era of COVID is that we are really rethinking how we deliver care and setting our new normal. And there are many visits that we consider routine care that can be provided virtually and don't require a face-to-face visit. For veterans who can have their care provided virtually, we're encouraging you, and we will be, even after COVID, encouraging you to continue to access care virtually if that's possible. For other routine care, like your colonoscopy, that can't be provided through a virtual modality, we've been prioritizing getting those services reopened. And again, we are always open for urgent and emergent care, any time-sensitive needs. Our emergency department's open 24/7. And if you reach out to your provider with urgent or emergent needs, they can get you the care that you need.
Next question. How come it was not published or publicized, excuse me, for the SEC VA visit that was coming to Atlanta?
I'll take that one. This is Ann, and I was not ready for that question. The SEC VA came to Atlanta a week ago Friday. I've been at many different hospitals where the secretary visits, and most of those are done very quickly. Schedules change all the time, and it just doesn't lead to having an opportunity for an open forum for a visit. Secretary Wilkie did come in to the Atlanta VA, as I said, a week ago Friday. He was here for 3 hours. He arrived at 7 a.m. And left right after the press conference. The press conference didn't even get scheduled till the day before. So those visits, you never know when things change. When dignitaries come into town, we don't really plan on it. Well, we're always planning on it, but really don't believe it's going to happen until a day or so before the visit. So there's just too much ambiguity. Too many things can come up when visitors of that stature come to town. And that's why those typically are not publicized.
Even pre-COVID, and it was handled that way.
Yeah.
COVID even throws another complication and detail,
Right.
right?
Yeah.
Okay, next question. This veteran wants to know, will Walgreens be participating in the flu shot program this year? And if not, why?
And the answer is yes. The goal is to have those providers, including Walgreens, CVS, Kroger's,
Costco.
the Costco. I think it was part of it last year too. And all those that were part of it last year, the goal is to have them all enrolled. And this is all being handled. And we want to expand and make sure that you have accessibility to the vaccine, and that is easy and definitely available for you when you have the time and opportunity to do it. So as soon as those are available, for you to be able to get it in those locations. We will also expand the communication to make sure that you get that there if you wish to.
This veteran wants to know, why should we believe you about fixing the phone system this time when you've been addressing this issue for several years?
I can't address what's been going on for several years, but when about a year ago, when it was we couldn't transfer phones internally, veterans were not able to get in through to NVCC for non-VA care. We basically just jumped up and down on the table until central office put us at the top of the list for a phone replacement system. Those are not things that, we can just say we're going to do that. Those are phone replacement systems are national purchases coordinated out of OINT. It's not even in VHA. So we really just screamed and hollered enough that we were able to get moved to the top of the list. So I really can't address years ago, but that's how we got the attention of folks outside of the Atlanta VA. And, now we are working with several different offices within VHA and outside of VHA to get that phone system replaced. And the other part of it is not just the technology, but it's also how are we managing the phone calls. And Danielle talked a little bit about having standard processes and having primary care call center, mental health call center, and specialty care call center who are trained and know how to deal with those calls. So, it's not only a technological upgrade, which we needed the assistance of others to get us there, but at the same time, reorganizing how we manage the phones. Danielle was asking earlier, well, don't we have ADCs? Yeah. Well, yeah, we do, but not on everything. Atlanta is growing so fast and is growing so much that we just flat out grew it. And there are some things we couldn't monitor. And so this new system will allow us to monitor everything and be able to know where the problems are and troubleshoot to those areas and move resources to those areas as volume increases. So that's the response.
This veteran wants to know, when will community care finally be taken care of? This is a question that we received from several veterans.
So we are definitely have increased dramatically the staffing in community care, and with this new effort and new provider of the network for community care, we are confident that we're going to have big changes in how the community care is provided. We definitely want to be able to have you have the care where you want it. We want you to receive it here if we're able to provide it, but we also recognize that you have at times preferences, and we want to be there for you as providing that ability to have the consult and have the services provided in the community. And we are committed to being able to support you in that.
Next question. Can you talk about the specific actions that you've taken to improve customer service at your facility?
Good evening, everyone. Some of the things that we have started with doing in improving our overall veterans experience has not only been making sure that we're still available for you during the pandemic, but also ensuring that if you don't have the answer, we will make sure that you get the answer. Our calls have remained constant. We are also available via My Healthy Vet and several other avenues. There is an Iris line. There is several sets of surveys that we take. We want to make sure that we're hearing your voice. We are also making sure that the services that you need are available in the check-in area outside in our pre-screening area to try to minimize the contact that you have within the facility so there's no exposure. We have also tried to improve the customer service. We're working on getting virtual visits for our advocates as well so that you still have a face behind the computer and making sure that we can address your issues and you know that there is a person that's actively working on your issue. We have maintained our timeliness in trying to respond to you. We've also implemented a new system called PATS-R. It's our PAT system replacement, and we document all of your issues there, and it has become a very good conversation piece between us and your providers so that we have the opportunity to ensure that your issues are being taken care of.
Let me kind of prompt you on some other things. So the PATS-R allows us to now track what the complaints are and be able to pinpoint where we have issues and be able to address them, whereas we couldn't do that in the past.
Absolutely.
So talk, if I missed something, expand on that a little bit. But also talk about with the new rollout of the new system where the services are becoming engaged, and it's not just a group of a few patient advocates who are dealing with these concerns, but we're engaging the services where the problems occur.
Correct.
Could you talk a little bit about that?
Absolutely. So part of the PATS-R system is that it literally opens a dialogue between us and the service providers. Whether you've got a compliment, a concern, or a recommendation, we want to make sure that that is noted. We put that in the system, and then we actually give it to the process owners, the service level subject matter experts. We ask that they reach out to you directly so that you feel as though you have the appropriate attention from the actual care providers. It has also given us a robust reporting system that we can go in and track not only what's wrong or what you are calling in about, whether it be recommendations and even compliments. 65% of everything that we touch right now is compliments, and we are very grateful for those. We are also, as a result of that, implementing a compliment program within the medical center so that we can boost morale and make sure that your thoughts are heard within our walls, so that our providers know that they are appreciated and they hear your voice and your gratitude for the services. We not only open that dialogue with them to have them contact you, but then we also open that dialogue to make sure that we change process overall. So we can't fix what we don't know is broken, but as soon as we do know that it's broken, it is up to us to be accountable and fix it. And that's what this system helps us to do.
Next question. Please talk to the veterans who are in need of surgery right now.
So, our surgery department, as many surgeons in the community with COVID, did have a brief period where we stopped scheduling cases and we're only doing emergency surgeries. That lasted just a couple of weeks at the very beginning of the pandemic. We did then reopen to time-sensitive and urgent cases, but did hold off based on recommendations from the National Surgery Office on scheduling what would be considered routine surgical procedures. We have gradually, over the past few months, while keeping a very close eye on the COVID numbers in our community and here at our VA, re-expanded our surgical services. And the surgery department, as of this week, is open at 75% of their pre-COVID capacity. And we are working to get that back up to 100% safely. I don't know if you had a specific question about a specific surgery, but if you do have a personal medical issue you have a question about, if you reach out through the Veterans Experience Office, we can direct that question appropriately.
One more Facebook question before we go back to the telephone. This veteran wants to know, can you clear up situation with the flu shots? He was told that Walgreens is not providing flu shots. You say they are. Can you explain?
So right now, Walgreens is not providing the flu vaccine for us as Veterans Administration hub, if you will, or a site where you can get it um, th- using the VA as the VA insurance. Um, Soon we will be able to do it. The goal and the national um, goal is to have the same providers that we had last year, where we were able to use Walgreens, CVS, Kroger's, Costco, all those sites that were available last year. And the goal is to have them added and available for you to go and get it there. So as of today, no, you cannot do it. And we will be announcing broadly as soon as you are able to get it in those sites too.
This veteran wants to know if you could talk a little bit about mental health for veterans who are desperately in need of that service right now.
So our mental health providers are actively seeing patients through multiple modalities. We offer virtual visits using VVC and via telephone. We are also doing some face-to-face care at several of our mental health only CBOCs out in the community. If you have an urgent or emergent mental health need, our emergency department is here. We also have information on the Veterans Crisis Line for anybody who has a crisis, and it's posted on our Facebook page, but we can certainly post it again. There are operators 24/7 who can address any crises. Oh, Dr. Correa has the 1-800-273-8255, press 1. This is our crisis line, which is available 24/7. We have continued to see mental health patients through the COVID pandemic, mostly using virtual modalities, but some face-to-face care as well. We can report that in the last month, we saw over 100% of the number of veterans for mental health visits that we saw this time last year. So we're providing services and we're expanding the number of veterans we can see through mental health. We do offer the majority of that care virtually, and it can be safely delivered through our virtual modalities. But again, if you have an emergency need for mental health, our emergency department is open. We do have a Veterans Crisis Line, and we encourage you to reach out if you're in crisis.
Our next question is from a veteran who states, I came to the VA pharmacy last week to get medications that I was out of, and was told since it is not deemed urgent that the medication has to be mailed. But the medication was urgent to me, and I wanted to pick it up and not wait for it to arrive in the mail.
So I'm sorry that I can only imagine how that felt for you, and I apologize for any delays in the service. We are encouraging all of the veterans who don't have an emergency medication, so a new medicine they need to start right away today, to get their medications through our mail services. And there's a number of reasons why we're doing that, but primarily we're trying to help limit your exposure and other veterans and staff's exposure to COVID. So as we look at how we deliver healthcare, we're encouraging people to use virtual modalities, and we're encouraging veterans to call well in advance for your prescription refills using our phone system. We can also put that number up on the Facebook page for the refill line, to call well in advance so that you don't run out of medications and you're able to get them by phone. And for veterans who have new medications that they're not required to start same day, to also request those as soon as they get the prescription, or ask your provider to just go ahead and enter it in the mail so that it can be sent out to you.
The next question is, what is the process for changing a primary care provider, and why does it seem to take so long?
So go ahead.
So that is a question that I am not ready to fully answer. I definitely apologize if it is taking a long time for you to get that change if you're requesting. I know that there is a process where you request that through your tap line, the telephone tap line. Another source and availability for resources and information would be the Veterans Experience Office. And I know that they will be able to guide you through how to go about that. And if you have any difficulties, I know that they will come to us and remove any of those barriers that you may have.
The next question is, when will pain management begin to see face-to-face appointments? Because it's taking a while for care in the community.
So thank you for that question. And I think one of the things we've really been trying to do is to prioritize opening up face-to-face care for services where face-to-face care is required, where care can't be provided virtually, and also for services where we know that there is less access through our community provider network. We have identified several services that we are prioritizing for reopening. So we offer pain services through a number of different modalities. We have our EVP program. We have our pain clinic, which is typically run out of the Atlanta VA clinic, the CBOC, here near the main medical center. And we also have our PM&R program that does pain injections. Both PM&R and pain clinic are seeing some patients face-to-face for those who have time-sensitive and urgent needs. We did recently expand to a second day for face-to-face pain appointments at the ABC, and we are working to prioritize reopening PM&R for veterans who need injections, which obviously can't be done virtually.
Our next question is, to eliminate congregating and direct exposure, can VA employees and veterans receive their flu shots at the pre-screening stations upon entry into the hospital?
So that's a great question, and certainly we are using and strategizing for being able to provide that care without adding to the exposure and mitigating exposure. So as part of the opportunities for veterans to get the vaccine, we're going to have the vaccine provided in a drive-through manner at the CLC circle. And then we are also going to have some ability to get those at the CBOCs in a similar manner. Some will have some drive-through, and some will have the opportunity to be able to park in a designated parking area for flu vaccines, where you will be approached by an individual that will be providing the vaccine to you. So yes, you're absolutely right. We're trying to decrease the exposure that the veterans and the employees will have at the same time that we want for you to get that vaccine at the most efficient way possible. Thank you.
This veteran wants to know, for real serious problems, why do veterans have to go through the patient advocate instead of going straight to the leadership team? You would resolve issues much quicker if you did so.
So I'm not sure that you're going to get resolution a whole lot faster going to the ELT, because a lot of folks send me emails, and there are times, last week I had a family emergency and wasn't around, so those emails sit in my emails for a while before I pretty much just forward them to the Veteran Experience Office to address. That's what their role is. That's what they're good at. And that keeps, as Ms. Pinard talked earlier, we are able to track and trend the issues when they go through the right systems. They have the connections in the services. We do as well, but this is their main job. This is what they're good at. And this is, it's what they're here for all day. Whereas when I get the emails, I'm doing that, at 6, 7 o'clock at night, forwarding them on to get them addressed. So, the VA has set up this system as with the Veteran Experience Office, and that is their role. So, I am never going to say don't send me an email, but, recognize what I'm doing is pretty much dispensing it out, just like the VEO office is. They have a whole cadre of staff that are trained and are ready to do that. And I think Lindsay has something
I
she
had
wants to
one other
add.
thing to add to that. I just want to let everybody understand that What I tell people all the time is the director has a medical center to run. It's our job to be able to take care of your issues and try to streamline processes for you. So we want to ensure that we are taking care of those things. We're giving them to the service level subject matter experts. So if you start with the PenTAD, which is totally fine to do in our executive leadership team, it frankly just slows down the process. We can get you to those proper places. They've got a million emails to forward every day to get through and to deal with. And they handle things at a much higher level. We want to make sure that we hook you up with somebody on a personal front so that you have those points of contact, not only just now, but also in the future. We want to empower you with the proper information to make sure that you are equipped not just today for this one issue, but forever.
Thank you.
Okay, another question. This question wants to know, why can't veterans call the C-Box directly? I guess there's been some trouble connecting
So-
with,
I'll try to answer that. As we talked about, the technology for our phones is a big deal. Atlanta's just been growing, and the technology didn't keep up. Yet, answering the phones, how we answer the phone, the answers that we give when we answer the phone needs to have some consistency. As I'll just tell a little story. When I first arrived and started doing my rounds through the C-Box, sometimes I'd walk into a place and there were 3 people answering the phone. Sometimes I'd go into a place and there was no one answering the phone. So that inconsistency does not lead to a high reliable organization. We need to have processes that are that those who do that job know what they are, and they need to be consistent. So no matter who you call or where you live, you get the same answer and the same response. That is a journey that we're on. It's going to take some time, but it shouldn't matter that you're not calling your CBOC. It should be that, and the goal is that you're going to get the same answer, the right answer, no matter who answers the phone. I expect that there's some concerns that, I normally call the Stockbridge CBOC and I can talk to my provider. Well, we need to work through the system, and with this rebuild, I think that's going to occur, that if you call and you need to talk to your provider, it doesn't matter that you call the Stockbridge CBOC or you call the Blairsville CBOC, that technology is going to be able to connect you to that provider no matter where that call comes in from. So I have heard, and I've been through other places that we've gone through this, and veterans want to be able to talk to Joan, who answers the phone every day, because they're comfortable with it. But once we get through this and we get this system in place, it's going to be transparent, and I think it'll be okay. I've seen the tide change, that, hey, you know what, I'm still getting what I need, and that's the most important part.
okay, we had a lot of questions for VBA, and I just want to remind folks, it's already posted on Facebook, but just a reminder, the VBA is having its own town hall meeting tomorrow where you can get all of your questions answered about VBA issues, and that will take place again tomorrow at 4 p.m. to 5 p.m. The number to call is 404-397-1596. Access code 199-771-1077. I repeat, 404-397-1596. Access code 199-771-1077. We have a lot of other questions about
Before Greg, so I talked with the leadership over at VBA about the town hall, because I saw that they were having one, and actually this idea of having the phone line, having folks be able to ask questions, that we didn't want personal information to come out onto Facebook Live, we stole that from VBA. And then we set ours, no, we didn't really do it on purpose. I don't know how it happened that we set it up the day before theirs, but I think we'll go back to joint meetings in the future. They already had theirs set up when we started talking about having ours. We stole this idea, and y'all did a great job setting it up, by the way, from VBA. So I think you'll have a very similar experience tomorrow. And then as we right size and get to the new way we're going to be doing business, we'll get back to doing joint sessions. So stay tuned, please.
Okay. So we pretty much answered all the questions. There's been other questions asked in a variety of forms, but I think we pretty much addressed all the issues. Just a reminder, if we have not, and if you think of a question that you didn't ask tonight, please send those to the patient advocate and we will address those right away. Any closing remarks from the leadership?
So thank you for your participation. We really, now that I let the cat out of the bag that I stole this from Patrick, we'd like some feedback on how this went for you, other ideas on how to do town hall meetings. We're open to ideas. We want to make this useful for our veterans and their families. So thank you for participating. Let us know what you thought. And have a wonderful day and get your flu shot. Oh yeah, Dr. Correa just set it up. Make sure, get your flu shot. And we're going to continue to think about ways for people to get their flu shots. If you don't have a car, you can't go through the drive-through. So how can we maximize making sure people get their flu shots? And there's a difference in being an employee this year in the VA. The VA has finally come out with I didn't say that. The VA has a mandate this year that all employees have to get their flu shots. That was not a mandate in the 25 plus years I've been in the VA. So as a health hospital administrator, I'm really happy about that. And so we'll be lining up with all the veterans to get their flu shots. And I encourage you to do that. And please be safe, wear your mask, wash your hands, socially distance, and have a wonderful night. Thank you all for participating.